can't blame Tinubu again. I came here with the justification that Tinubu is wrong. I came here with the justification that Tinubu is aware but doesn't care. He's not empathetic. But now you're telling me that Tinubu is not even aware because the people that are supposed to feed him this information are trying to pander so that they can be sycophants and get some crumbs. More change for me, my Lord and Master, futuristic
I'm
Lord and
100%
Master.
to what you have said.
Hello and welcome back to your favorite show, Diagnosis. I've missed you all. Happy New Year once again. Today we're going to be having a very interesting topic that is going to piggyback off of the one we had last week, where the Nigerian government is planning to fix the brain drain by having more medical schools and, pairing those medical schools with already existing federal medical institutions. Well, they think that's one way to fix it. And today we have our dearest president saying,
don't worry about what you're hearing about the Japa syndrome. We will train more people. And then we can supply them safe.
Again, putting Band-Aid on a big gash. Well, today we have a wonderful guest, Dr. Olofin, in the building. Please give us a standing ovation for him, please.
I'll clap for myself as well.
Hi, Dr. Olofin. It's wonderful to have you. I've been trying to get him on the show for a long time now. I mean, I had the opportunity to anchor the scientific conference. There was what was it again?
One of
the panel,
Health Week,
the Health Week. There was
the panel
session, for the scientific conference last year, 2023. And Dr. Olofin stood up and started to speak. Gave me joy to see that there's somebody in the system that is not only rising through the ranks, especially through the political arm of, the Nigerian Medical Association, but is actively fighting for better. What he was saying that day, his passion, his zeal, and all the things he has done to try to improve the Nigerian medical system, I was floored. And I just said to myself, the people who watch this show, they need to see this amazing doctor. Now he's a principal medical officer, according to him, and a wonderful SR. But for today, he is our wonderful guest. And Dr. Olofin, once again, it is wonderful to have you here. We're so happy.
My pleasure. Thank you very much. I'm happy to be here.
Thank you for honoring us. So today, like I was saying, last week, you saw the show, right? Last week, we talked about the fact that the Nigerian government thinks that the best way to fix the brain drain is to train more medical doctors. They were talking about training 2,000 to 3,500 new medical doctors. In fact, they were not talking about those that are already in the system being trained. They are talking of new people that they will bring to the system. Then they will build new medical schools, and they are not going to build new teaching hospitals. Those medical schools will be attached to the already existing teaching hospitals that will now be overburdened. Imagine such a thing flies.
Yeah, I saw the news and tried to swallow it, but it's quite heavy to swallow. Right? What can we do? As far as I'm concerned, the problem we have in Nigeria at the moment, facing the health sector, is a huge one. And truth be told, it's not affecting only Nigeria. It's affecting, let's just say, the whole world.
How do you mean?
Yeah. Talking about, now we have to be specific with these questions. If you ask, how do I mean? I might go far into that again. I won't just go back won't come back to the main topic.
We'll come back. But just right. Touch a bit on what you mean so that we can understand. The
population of the world continues to evolve. You have more people, more youth people who have the strength to study, not even willing to study the
school
course.
As scam.
And they say so, but I'm not in that party of school as scam. Because school is not to make you rich.
Yeah.
First of all, school is to give you knowledge. So whatever you now do with your knowledge is your business. All right. So even in the Western world, many young people won't want to stress themselves to become a doctor. So the services of medical professionals will be in high demand all over the world as time goes
We'll
on.
be in high demand soon,
It's
guys.
just like that. So coming to the topic, coming to the focus of discussion, the president has said that
We will train more health workers and even
Yes.
supply.
yes,
Supply chain.
our president, I respect him so much. He's a wealth of knowledge. Yes.
Okay.
And I believe he has gotten to that position where he is through several years of planning. He's a futuristic man. But the problem we have on ground, every problem you have, that will be in your planning. We have a long-term plan, we have a short-term plan. This plan looked to me like a fantastic long-term plan. But a lot would have died before that plan manifests.
Okay.
That's even if the plan is able to manifest.
Just to cut you short, right? I mean, you respect our president. He's a futuristic planner. That's amazing. That's the first time that well, it's not the first time I've heard people say it, but it's the first time I've had somebody that I know say it,
Yes.
right? With all that is happening, especially with regards to the healthcare sector, do you think, what do you think he could have done better?
Yes.
Dollar is 1,000 plus, 1,300 plus
Definitely, I would have
today.
answered that question.
Medications.
Because I was just talking about,
Okay.
in the
Let
process.
me give you the
Yes.
opportunity.
I said what he has said is a long-term planning. It's like building an investment. Yes, Nigerian doctors are very good out there. You decide that, okay, you want to produce so many so that you can export, good, but that won't fix the problem we have on ground now. Let's talk about the problems and the complications of what he has said. At the moment, we have medical schools churning out. In Nigeria, I think going by the statistics of last year from the enemy president who spoke last year, we produce about 3,000 medical doctors every year in Nigeria. And we need as much.
How many do we export through JAPA?
Through JAPA at the moment, I think as at last year, they have about 11,000 plus.
That left this country?
Yes. But the thing is, that is not the part that should shock you. WHO said at least you should have a doctor to 600 patients. Currently, we have about 1 to about 8,000.
I thought it was 10,000 from a statistics. I think 4 years ago, the statistics was 1 doctor in Nigeria to 10,000 patients.
What I saw from last year,
Okay.
late last year, was about a doctor to 8,000. You know, these statistics will depend on something from different person running doing these statistics. Then now, this is it. The enemy president said it will take about 20 years for Nigeria to have enough health workers that will cater to the needs, the medical needs of Nigerians.
Yeah.
And if we keep churning out these 3,000 per year, it's going to take at least about 10 to 15 years to even get there. Now, the medical students we are churning out now, you know, the study of medicine is more of a mentorship thing.
Yeah.
One person won't train a medical student. But when the chunk of people who are to train these students
have it been exported out,
have found their way out of the country, will these students just study on YouTube?
I think that's his plan. That's your futuristic plan.
That will be a disastrous one.
Yeah.
So what are those things that needs to be put in place to ensure that doctors stay back in this country? That's the most important thing. We still have many doctors on the street jobless.
Mm-hmm.
I won't say, let me make it sound better. You know, working with a private hospital.
I think he's jobless.
Working with a private hospital who tries to pay you a
200K, 180, 100,000, 80K. In Abuja, in the federal capital.
And they still want to make you feel like they are doing they're helping you. Your take home is not enough to take you home. And we have federal government institutions who are not employing as much as they do. They are not more. If the teaching hospitals in Abuja alone wants to employ according to their need, they will mop up doctors from the street of Abuja, from Lagos, from everywhere. It will get to a point there will be no doctor to employ. Because what they need is far more than what is available. They did some employment late last year. National Hospital got some resident doctors from other institution cut. But the number that came in was quite abysmal compared to what we're expecting to see. So if they don't employ, the working condition is still poor.
Yeah.
Remuneration is still poor. Now somebody will wonder, how would employment help with Japa? A lot of people wouldn't have left this country if they have a permanent employment. It delays your thinking. You plan.
Is that why you've not Japa?
I will say that categorically. That is the reason why I'm still here. Let me give you a short story. I went for an exam in 2012. Went for primaries in surgery. 2012. We were 5. I drove my car from Lagos to Ibadan. 5 of us went for that exam. After the exam, we all failed. Today, I was employed by FCTA. Tola, one of my friends, was employed by Lagos State, and the remaining 3
are
not in Nigeria at the moment. And they are doing better than the rest of us.
In Nigeria.
We eventually passed. Passing and getting employment, we now kept saying, okay, I will leave. When you plan to leave, maybe FCTA will now pay one allowance. You'll be like, okay, Nigeria seems it's going to appear there's light at the end of the tunnel. But for God's sake, we are not in a tunnel. We're in a pit. There's no light at the end of it.
If you look up,
you just have to come out.
You've talked about the president being futuristic. While I don't agree with that, it's tweaking me somewhere in my chest. But for him to come out and make such a statement, right? It just shows like he doesn't care about, like it shows this I don't care about what is truly going on. It shows that he has not gone to do his homework on what truly are the issues that are causing Nigerian doctors to jackpot. It shows that he's not even empathetic towards our plight.
I won't say he doesn't care.
So you are saying he cares?
Based on that statement alone, I won't judge whether he cares or not. I just hear it on TV. Forget about all these things we hear on TV. Even the ones that sound very good, it's still a lie.
But the things we are seeing shows he doesn't care. For a president to come and say, we will train more medical doctors and even supply to other countries, shows that he has not done his assignments. What is NMA trying to do to fix this? What has NMA done to call him back to say there are papers that have been published to show the problems with the Nigerian healthcare sector? There are different interviews that have been done to tell you the reasons why doctors are leaving this country in droves. These are some solutions we have come up with. These are some solutions that can be preferred to fix the system. Shove it down his throat.
Bringing NMA in. I don't know what NMA is. I saw something on our page which I tackled of all the issues on ground. I saw a memo. You're talking about ensuring that we do as much call as we should do, and I can't remember how they fixed it. But to me, what are they talking about? We're talking about employment. How can one registrar be in a unit and be on call for 3 months?
What's talking about the problem? We're not talking about how...
So NMA, as far as I'm concerned, I don't think they are really in the direction of this issue we're talking about. A state of emergency be declared.
That's number one, for health.
In the health sector. At the moment, if there is a strike...
Bring me to strike.
For the fact that, all right, strike on employment, strike on fixing hospitals. To me, it's not a big, you've not gone, you are not doing anything wrong.
No, but Dr. Olofin, our strike actions we've had different types of strike actions, right, that have yielded nothing. It always almost ends up with somebody going behind to collect some funds.
NAD was talking about this employment thing and strike. I was one of those who voted against going on strike.
Why?
By NAD. NAD is the National Association of
Resident Doctors.
This fight of JAPA, brain drain employment, is the fight of enemy. Because it's not only the doctors who are in training that are affected. The worst hit are those working with one private hospital in Khanoba.
Exactly.
And those still walking around with result of primaries looking for residency slots. Those are the most hit. So we've talked about it. This is an NMA fight. For crying out loud. Most of this noise, when it gets to where it matters, they don't come up. These
Why?
topics don't come up.
Why? I'm asking, are their mouths tied? And that brings me to you, right? You are the former director of socials for ARDFCTA.
Yeah.
Have you been opportune to get into this room? And what have you done in that position?
As per my office, I don't get to the room.
Who gets there?
The president and the secretary.
Of ARDFCTA.
Yes.
So, do you know if your former president, because you served with the former regime,
Yes.
do you know if they have brought up these topics when they were in that position to speak?
They've brought us several hot topics. But
It's not a hot topic,
listen,
this particular one.
listen. You know, this is the one you have brought to the table right now. There are several topics. The ones that cause arguments like this. In fact, some people have been told to shut up. There are hierarchies. It's our elders. Our elders are in front. They are the ones selling us out.
So, when I say that I really want to be attacking the enemy, they say I shouldn't do that anymore. Because if we
I will attack ourselves. I will attack those are people who take our information to them. They are the ones I attack. But those people are at the top. Yeah. It's information you give them.
The president of the enemy is not aware of unemployment. Is he unaware of unemployment? Is he not does he not know what's going on? Fully
aware.
So who is feeding him information? He's the one that's supposed to be our loop system to the government. So he's the one we should attack.
Even in meetings where we think these important issues are discussed, people are silenced.
Dr. Olofin, before we round up, because our time is almost up, from what you said, right, I don't see any hope in sight. If the people in power at the moment are going to these positions to speak and their mouth fails them.
Unfortunately, you've brought somebody also who is not seeing you. I told you we are not in a tunnel. It's at the end of a tunnel that you see light. We're in a pit.
So how can we
come out of the pit?
Yes.
Yes. This line we are trailing, all these you are seeing, all this line we are trailing will lead to nowhere until we make a U-turn.
What is that U-turn?
Now what's the U-turn? Enemy is the only one I can hit here. The mother body of doctors in Nigeria must speak for the doctors and speak hard. Unfortunately, a lot of people want to also be on the side of the government. So you speak from both sides of the mouth. Like I said, if we declare a state of emergency on health, stop patching up things. If it's not working, it's not working. We'll get a headway. For instance, I remember in my hospital at a point where we are short-staffed. We have fewer staff in the accident and emergency. I was to do the roster to cover all days of the week. I can't. With the people I have, I can't make them walk through all the days of the week. I'm sorry. Sunday and Saturday were left out. It was a battle. It was fares and all that. No AIE must be covered, blah, 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 blah. I try to advocate for these guys with the management. And at the end of the day, one way or the other, in silence. It's like that. So on Saturdays and Sundays, every department who have a patient in AIE comes down to manage their patient. But if at that point I decide to be a 100% friend of the management, then I'll stress the people.
You become like HR.
If at every level
we have people that
can just do this is the little I have. If even at the large scale, people can just do this thing, but we'll have results.
No, I mean, they're telling us from the studio that our time is up, right? And we're going to have you on for our next week's discussion. We want to compare the BMA, the British Medical Association, with the Nigerian Medical Association. And there are a lot of things that we've talked about today that I would love for us to talk about next week, because for me, I can't blame Tinubu again. I came here with the justification that Tinubu is wrong. I came here with the justification that Tinubu is aware but doesn't care. He's not empathetic. But now you're telling me that Tinubu is not even aware because the people that are supposed to feed him this information are trying to pander so that they can be sycophants and get some crumbs. More change for me, my Lord and Master, futuristic
I'm
Lord and
100%
Master.
with what you have said. I'm 100% with what you have
So we
said.
would have to visit this topic next week. Guys, this is the first time I think I will be doing a show and we're not concluding before we have to end it. But stay tuned for the part 2. It's not much of a part 2. This is basically part 2 of last week's episode, right? But stay tuned because we will talk about more of these issues with our next week's episode. I hope there is finally a way we can all come out of the pit. Maybe there's somebody that should throw rope down for us.
We need that rope.
Who is going to throw the rope? Who is up there?
But we need to come out.
Alright.
We need to come out.
Next week, please, let's go and do our research on who will throw the rope down for us. Guys, thank you so much. Don't forget to subscribe to our YouTube channel and our podcast on Spotify and Apple. Don't forget to follow us on Instagram, on X now. And please, 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 comment, send your own opinions, talk to us. We want to know more. We want to know what you're thinking. Maybe you can be the one to tell us who is up there and can throw the rope for us so that we cannot come out of this pit. All right, guys, it's your favorite show, Diagnosis. Please stay tuned for next week. Bye.